UPTH is celebrating 45 years. I am delighted to be here. I'm in the house of my father in public relations. He was a one-time director of administration. He served as an administrator in different capacities, including the acting public relations officer. Over to you, sir.
I am Dr. Akie Opuene Hart. I'm a title citizen of Bonny Kingdom with the title Amasenebo. I was employed at the University of Harcourt Teaching Hospital in 1985, and I worked for 35 years. While in service, I worked in the office of the Chief Medical Director for 9 years. I also work in the office of the Director of Administration. I work also in clinical service and training. I also headed junior staff establishment and also headed the senior staff establishment, also headed general administration. I was also acting public relations officer, and also I was the administrative head of clinical service and training before I became head of administration, then later acting director of administration, and later substantive director of administration. Administration started from the beginning at Emoha, when we had the administrative officer in charge, headed by Chisom Jaja. Later on, when we moved to the temporary sites, we now had the principal secretary in the person of Mr. Eric Aworabi. Later on, the board now created the position of director of administration, and he became the first substantive director of administration. So we see him as the father of administration in UPTH because he laid the foundation for administration and he trained us, and we have a very close relationship with him even up till now because he mentored us very well. Now, looking at administration in the past, present, and in the future, I would say that the earlier fathers of administration, they laid a very good foundation in terms of the culture they inculcated in us, in terms of the virtues they inculcated in us, and administration grew. And one thing I learned from our big boss, Sir Eric Aworabi, is working in harmony with the Chief Medical Director. So he worked in harmony with the then Chief Medical Director. They worked together, and there was harmony and there was development in the hospital. And all the foundation strides were made during that period because of the perfect harmony. And that is why also we always preach not only continuity but harmonious working together. So when I became the acting director of administration, I worked in harmony with also the Chief Medical Director that I worked first with, which is Professor Aaron Ojule. And the second person I work with is Professor Henry Oboma, first as acting director of administration and later as substantive director of administration. I always say, and there are empirical evidence to support that the period of time I served as the director of administration is the golden era in UPTH. Why is it golden era? As a young officer, there are so many things that I love, so many things I feel should be done the way they should be done. That did not happen. But when I became the director of administration, I saw the Chief Medical Director, Chief Executive, that had more zeal than me in terms of staff welfare, in terms of motivation. And that person is no other person than Professor Henry Uboma. So the synergy blended very well, and we worked together in harmony. So all that I learned from Aworabi, I deployed it. So throughout my period as director of administration, there was no crisis. For the first time, there was total harmony between clinical services and training and the administrative directorates. We work hand in hand. I want to say that during the period of time I served as a director of administration, for the first time we had directorate cadre in the hospital. We had substantive director of finance, and also in other directorates we had it. And also we had 100% junior staff promotion. 100%. We promote all the junior staff except the ones that have bad records, and even the ones with bad records we try to see how we can reform them. And also for senior staff, we also had 90% or above 90%. Also, because what the chief medical director did is that because of his love for the staff, because of his belief in motivation, he will always travel, and I will escort him. We will go together to Abuja to create positions so that during promotion we will not have any problem. So basically, what Professor Henry Ugboma did that made me to say that this era, his era as chief medical director, is the golden era in the hospital, is that he employed the carrot and stick system of administration. When it is necessary, he will motivate staff. When there's a need for discipline, he will also discipline staff. And for the first time, he introduced professional indemnity for staff. So any staff that is on duty, if there's a problem and you're taken to court, the insurance company will pay for whatever damages. So it didn't give our doctors, our nurses, and all the health professionals confidence that nobody can jail them while they are on duty. So that professional indemnity insurance was done. And also, Professor Henry Ugboma also resuscitated the group life insurance. And through the group life insurance, now any staff that dies on duty, there's a very big benefit that will be paid to the family. And to ensure that, he had to take a memo to the board had to approve, he had to take the memo to also the head of service, and it was approved. So if you ask the success of Professor Henry Ugboma's administration, it is the carrot and stick. He never joked with the welfare of staff. And I want to just mention something now, that when the House of Representatives and Senate came to the hospital, all the trade unions in the hospital now confirmed that they are working in harmony with the management. Such thing doesn't happen for the professional bodies, the trade unions that are supposed to be having antagonistic relationship with the management to come out to say they are having closer relationship and that there is no problem. How did we reach to that level where the unions are now collaborating with the management? The CMD set an open door policy. Whatever that is released, he will make it known to the professional groups and trade unions, and they will now see the constraints and the challenges. And through an all-inclusive stakeholders approach, all the stakeholders in the hospital are aware of what is coming in and how it is judiciously utilized. So everybody is being carried along by that administration. And I enjoyed my work as director of administration because the recommendations that I'm making are being taken by the CMD. And I'm lucky to have dedicated staff like the public relation officer, and then also other dedicated staff that work together. So we work in harmony to give maximum support to the chief executive. That maximum support now led to the creation of more units in the hospital, creation of more departments, creation of more subspecialties, and all the accreditation visit to the hospital. All of them were successful. Why? Because of the synergy between administration and the clinical service. In the clinical service, we have the administrative head that is there working with the chairman medical advisory committee, working under the chief medical director, and they work harmoniously to the level where all the clinical programs are moving on smoothly. And whenever the accreditation team comes, they commend the hospital. And also on our area in administration, during this period, a lot of trainings, in-service trainings were done. Long time on were done, short time on were done. And we now are having competent, energetic and empowered staff that are ready to deliver. And the most important thing is that the chief executive is vision. He has a vision to grow the hospital. He has a vision for staff welfare. and that is why there's success in the hospital. So at the point I was retiring in 2020, I was so happy that we have 100% promotion rate at the junior staff and over 90%, and we have created the directorate, and we have professional indemnity, we have group insurance, just to mention but a few. And all this will enable by the maximum support of the chief executive. He is the visionary. But I want to say that if you look at all the clinical achievements, the skilled manpower, the new staff, the new equipment, the new subspecialties that were established, the successes at accreditation, all happened because of team approach to achieve the mission statement of the hospital. So like I always joke, people will say, because that was when I served, I said my own period is the golden era, and I will have a compendium that we publish that listed all that we did, both at the clinical and administrative, and there's so much, and people appreciated it. We also have a perfect relationship with the host community, and a CLO was also created that will liaise with the host community, and we'll start rotating it from host community to host community. This host community will be for 1 year, it will rotate to the next host community, and will not give the host community a sense of belonging. And we documented all the achievements at the administrative level and also at the clinical level. So, and what helped me to succeed is that at least I went around almost all the departments and almost all the offices. So by the time I became the director of administration, I've been head of units in administration, and the public relations officer. Both of us who worked, published several news magazines. So, and I'm happy to see all the people I work are now in positions as head of units and heads of department, and they are doing well, just like also they were doing well when we worked together. So I want to say that the key word is collaboration. The key word is team approach. There's one area that we achieved success that led to peace and harmony in the hospital. Every approved scheme of service, every circle of government, we implemented all, and the unions, they were happy. So when you motivate the staff, you can see that they will bring up their best, and all this good initiative of long time and short time training for staff, skill development, should continue, because it's the skill development that has led to having you as the public relations officer. It is what has led to having all the unit heads now in the hospital, because they were trained and retrained for them to deliver effectively. As we march forward to this our 45th anniversary celebration, if you look back and see what we have done, we can see that the hospital has really achieved so much tremendously, both at the clinical service and both at the administrative service. So all what we're doing, we're going to celebrate the achievement of our fathers and also our own achievement. So it's a good celebration. And also I'm happy that this celebration will be done during the administration of Professor Henry Boma, because he has done so much the past 8 years to reposition the hospital, to give life to areas that need life, and to boost. We used to say he gave fresh impetus to the hospital. So we're happy that all of us are marching forward with one accord for this celebration. So I want to congratulate the management for sustaining these good works. I want to congratulate all the unit heads, and I want to be selfish to congratulate all the administrative unit head more for keeping the flag flying. Also, I want to also encourage the director of administration to continue where we stopped, and also to work in harmony with the chief executive the way all of us have been working, so that we can achieve the goals and sustain what has been achieved to the glory of God Almighty. So that's what I will advise. I hereby wish the University of Port Harcourt Teaching Hospital a happy 45 years anniversary. I want to specially commend the Chief Medical Director for the good work he's doing. I want to commend the Chairman Medical Advisory Committee for giving maximum support to the Chief Medical Director. I want to congratulate the present management of University of Port Harcourt Teaching Hospital for not only sustaining the good works that they started 8 years ago, but deepening it and expanding it. So I want to congratulate them. So as we all look forward to this anniversary, we'll be there. It is time for merrymaking. It is time to clean our classes and to celebrate. I want to say congratulations to the hospital for the good works. Congratulations to Professor Henry Boma's led management for this good work of not only deepening but sustaining the good works of delivering qualitative services, not only to our catchment areas but beyond. So congratulations and happy 45 years celebration.
Thank you very much, sir. You have said a lot. You have advised. Thank you for having us. Thank you.
Thank you.